Hello, my name is Stephanie Armstrong, and I am presenting on my summer research titled Fractional Tumor Burden is Predictive of Overall Survival in Patients with Newly Diagnosed High-Grade Glioma and Non-Gross Total Resection. A diagnosis of high-grade glioma has very poor prognosis with median survival around 15 months. The best outcome is when a neurosurgeon can maximally resect the tumor, but often that is impossible because the tumor is close to eloquent areas of the brain, it is diffuse, or because a patient is already too sick to undergo a surgical procedure. We need to better understand these gliomas prior to surgery to maximize safe surgical resection and form a more targeted post-surgical treatment plan to extend patients' overall survival. Our group hypothesized that fractional tumor burden, FTB, a validated perfusion-based MRI biomarker that maps tumor burden per voxel, will be able to accomplish just that. Using the FTB maps, our group compared overall survival for patients with high pre-surgical FTB greater than 70% and low pre-surgical FTB less than 70% to evaluate FTB in clinical decision-making for newly diagnosed high-grade glioma. We retrospectively collected data and created FTB maps in a software called HOROS on 24 patients with WHO 2016 grade 3 and 4 glioma and subtotal resection or biopsy. Those with gross total resections were excluded along with oligodendrogliomas. The patient demographics are displayed in Table 1 with no significant differences except for the average FTB in each group. As seen in Figure 1, the FTB maps take the T1 contrast-enhanced regions registered to the DSC perfusion scans and delineate voxels into 3 groups. Red, which is indicative of high tumor burden, yellow is low tumor burden, and blue is no tumor. Adding together the red and yellow voxels, or high and low tumor burden, we stratified 2 groups based on fractionated tumor burden percentages of greater than or less than 70%. With these 2 groups, we ran them through univariate and multivariate analyses to better understand the patient's overall survival. Figure 2 shows a forest plot of the hazard ratios with a 95% confidence interval. Demonstrated by the 2 red asterisks, we found significance, p-value less than 0.05, in sex and tumors located in deep regions of the brain that affect the association between FTB and overall survival. After adjusting for age and deep brain location, we took a look at the Kaplan-Meier survival curve, which is shown in Figure 3. The red line is FTB less than 70%, and the green line is FTB greater than 70%. The survival analysis revealed significant differences between the FTB high and low patient groups. The median overall survival was 24.18 months for the FTB low group and 14.44 months for the FTB high group. Based on these results, fractional tumor burden can be used pre-operatively to distinguish short and long-term survivors in patients who are unable to receive a gross total resection for their high-grade glioma. In conclusion, these results suggest a clinically relevant role for pre-surgical FTB to distinguish sites of non-tumor and varying degrees of tumor burden, all of which can appear very similar on standard MRI. Therefore, improved tumor resection and pathological diagnosis should result, likely leading to improved patient outcomes. Thanks to my PI, Dr. Schmanda, with the Department of Biophysics and Radiology for her support and guidance on this project. Lastly, thanks to the Office of the Dean and the Department of Neurosurgery and the NIH NCI who funded this research.